Hello, I'm Dr. Paul Pasarilla with Murfreesboro Medical Clinic, one of the general surgeons here, and today we're going to talk a little bit about hernias. So when someone has a hernia, the goal of surgery is to fix the hole that's in the wall, and traditionally, this was done through an incision over where the hernia was located, and the surgeon would go down and sew the muscles together. In the late 1900s, we started adding mesh to help reinforce the repair so that you'd have a better chance of it not coming back. In the late 80s, early 90s, we started doing laparoscopic repair, which is where we make a few little holes and then a piece of mesh would be placed in the abdomen to cover the hole. And that was advantageous because you didn't have a big incision, but it did cause a lot of pain because of the way that the mesh had to be secured to the muscle and to the tissue. So more recently, we have started doing robotic hernia repair. I've been doing them for over 5 years now, and the advantage is the robot, the tool allows me to not only put the mesh in, but with less pain because I don't have to put as much securing mechanisms to hold the mesh in place, but also actually allows me to help create a true return back to the way God made you by closing the hole before we put the mesh in. And so that has decreased the recurrence rate as well, but also more importantly has allowed for people to recover faster and easier from surgery. So those are kind of the three main ways we do it. In our group now, all of us can offer robotic hernia repair, which we think is a big advantage to our patients as far as recovery, as well as the ability to get you back to a better quality of life. So when people hear robotics, they think that it's some machine that's doing its own thing, and I have to always reassure patients that the robot is really a tool that we use that makes us able to do more advanced techniques through very small incisions. Your surgeon is always the one who's controlling the machine, but the robot is a tool that we then will use to control instrumentation, which allows us to make much more fine movements, which allows us to do things like advanced sewing, taking parts intestines apart and then putting things back together, all through very small holes, which helps expedite your recovery and minimizes your pain. While hernia surgery is appropriate in many situations, the final decision about what type of repair and if repair is even appropriate is a discussion to be had with your surgeon. Every patient is different and unique, and we tailor our treatments to the patient. So if you're struggling with a possible hernia, just know that we are here at MMC General Surgery ready to see you and evaluate you. You don't even, in most cases, need a referral from your PCP. We would be happy to talk with you and help you make the best decisions for your healthcare.